So, formally, hello everyone. I would like to welcome you at our session towards resilient recovery. I'm Lina Liakou. I'm the Global Director for City Engagement and Knowledge for the Resilient Cities Network. We are a global network of cities from across the world, supporting them in building their urban resilience and fortifying their systems to the different challenges, whether these are shocks or stresses that they face. Today, we're going to focus on recovery. And I was just telling our panels that we had a similar session last year talking about recovery. It was at the beginning of, I forgot, I've lost a track of time at this point. It was at the beginning. No, it wasn't at the beginning of the crisis. It was at the midst of the crisis. And it was at the time where cities were kind of planning the recovery plans and identifying the methodologies and the processes and the challenges that we're facing. Now, a year after, almost, I would like us to actually focus on what we've learned and what we are doing on recovery, and recovery that actually strengthens our cities and makes them more resilient. So a recovery that doesn't just take us back to the previous status quo, but actually we move forward, and we've strengthened our social networks, our economic ecosystem, and of course helps us accelerate our climate action. So today we have with us three city representatives from the Greater London Authority, from the City of Athens, and from the City of Tel Aviv Yafo. And also we have two experts. We have Dr. Raymond Swartz from the USF, and Dr. Alexander Shushenko. I think Alexander will join shortly. That will focus specifically on green recovery. The structure of our session: we're gonna go through first an initial presentation from our panelists. We will start from the cities, and then we will move to the experts. We will take approximately 10 minutes per panelist. And then we will spend the rest of our time actually discussing both among the speakers, but more importantly, to try to hear from you. So please add your questions at the Q&A. We will monitoring the questions, and we will use them at the Q&A session. So without further delay, I want to start from Alice Reeves from the Greater London Authority. Alice is the Deputy Chief Resilience Officer of London. She has delivered London's first citywide resilience strategy and set up the first cross-organizational data sharing capability to develop intelligent risk management across the capital in response to the coronavirus pandemic. So Alice, we are looking forward to hearing your experience in working in London around COVID, learnings around that, and how we build a more resilient city.
Thank you very much for that introduction, Lina, and good morning, Malmo, I guess. So thank you. It's really great to be here today, and it's really exciting to be back at a big event, which is probably the first time I've done one in a really long time, or what feels like a long time. So I'd like to talk a little bit about London, where London is in terms of recovery, and what has changed in our approach to strategic resilience building now we're learning to live with the pandemic. So it's probably worth me giving you a little bit of context and information on London. So traditionally, our resilience has been focused on disaster response, and it's about ensuring that when we have an emergency, we have plans for many, many different agencies to work together. The way this happens is through the Resilience Forum, and the Resilience Forum is a partnership of shared interest. So it includes the public sector, so the emergency services, local government, health services. It also includes the private sector, which is people such as the utility providers, transport providers, business, and also the community and the voluntary sector. So the Resilience Forum basically exists to make sure we look at our risks, we have plans to deal with our risks when something goes wrong. So since 2004, this has worked very well. But in the last few years, what we've noticed is a really, really big increase in the amount of time we are spending responding to events. So when the risks actually happen. And in the past 3 years, we think we've spent more than 50% of our time actually managing emergencies. So maybe 5 years ago, this was 20 to 25% of our time. So that change is enormous. And of course, the more time we spend responding to emergencies, the less time we have to look at mitigation and preparation and long-term strategic planning. What's also really noticeable for us is in the past, our emergency response efforts were very short, they were very focused. Now we're seeing emergency response efforts that go on for many weeks or even months, and that's not just because of coronavirus. At the same time, equity and vulnerability have always played a role in our response and recovery, but maybe not a very big role. This has completely changed. So these issues are now much, much more central to how we manage our responses. So we've kind of had to think again about how we manage this strategically and how we prepare strategically for a resilient future. So to give you an example, in London in the past month, we've maybe been involved in responses to gas shortages, petrol shortages, food supply problems, pressures on the health system, as I'm sure everyone has, rising inequality, and then also things like coronavirus. So many of these things we do not have any power to solve at a city level, but they are big challenges for our citizens, so they have to be, and they are really important to us. So how do we manage this? Clearly, we need some level of strategic solution that will help us. So we've had some really important learning from the past year and a half, which means that we've really looked again at our strategic approach to recovery. So first of all, we always need to do more to engage and empower our communities and help our communities themselves work out how to manage and recover in any situation. So, for example, since we started dealing with coronavirus, we've adapted our response and changed our response strategically and made the center of this communications with public. So that is our main activity. And it's had really big results. So, for example, once we started targeting individual small communities in London, we saw a big increase in vaccine uptake. So that hyper-local level is really, really important. The second thing we've learned is that we need to understand our risks and stresses much, much better than we already do. We've had a risk register for a long time, but what we didn't have was what that real impact of the risks were on city systems as a whole, and that includes our communities. So our plans previously we understood as how we manage the risk together and what we do when the emergency happens, but not the impacts. And actually, it's the impacts that we think now we need to be much better prepared for. And the third lesson for us was in the past, we found it quite hard to talk about developing resilience to long-term stresses. Because of coronavirus, we found it's generated a lot more awareness of the need for resilience and understanding what resilience is outside the technical community, which we are now using as a unique opportunity, basically. So we've used this, first of all, we've used this heightened awareness of resilience to launch the recovery program. And the program recognizes the value of building resilience in areas we traditionally did not think to be part of disaster preparedness, but definitely are. And because people no longer see resilience as a technical subject that is linked to emergency planning, it means we've presented it as something everyone can do and everyone can have a role in. So we've been working closely with policy leads from all across local government in London to help them understand what resilience means to their specific policy area and to them. And we've used that to develop the big strategic recovery program. So there's a lot of strands to this program. It's quite a long-lasting program, and I'm only going to talk about a very small part of it, but it is a really critical part. So one of our recovery objectives is to improve our grassroots resilience by building strong communities. So what this does is we want to be able to empower communities to design and set up community hubs for themselves. And what these hubs will do is they will enable connectivity within communities by providing opportunities to volunteer, by providing community support, and most importantly, by providing connection. So these hubs will enable Londoners to lead their own recovery work at a macro level, sort of micro level within their own communities. So that, again, hyper local. So what do we want the outcomes to be? Well, the idea is that this will generate community-led solutions They will build feelings of belonging to an area, to a community. And it'll allow work between people from different generations, between different backgrounds, which we think will increase the kind of support networks in specific communities. It will also build connections for people from different age groups, different backgrounds, and also ultimately link communities together. And we hope that this will also amplify the voices of previously unheard Londoners, so people who didn't have a voice in the rebuilding process. So as well as this idea that we have stronger networks in the city, we think this will help people engage locally with their local communities, but also with their local areas to build resilience. It also helps us as local government basically understand community needs and issues much better, and therefore support Londoners much better. And we hope this will allow Londoners to influence change as we build systems and processes for the future. So it'll help them be heard more effectively. Other recovery work also looks at climate-related actions, and this is where we're really starting to try and look at co-benefits. So one of the challenges to being a city, and no doubt this is a common theme for many, many people, is that the impact of coronavirus may have been made worse because of pollution. And this and more health issues in general have been a real driver for our recovery work. So the major focus of London's Green New Deal, which is one strategic aim of our recovery programme, is to improve air quality. So we already had a lot of plans in place and strict rules for polluting vehicles entering London. This year we have expanded the ultra low emission zone, which is the zone that requires really badly polluting vehicles to pay to enter, which now covers most of London, and that will improve air quality for everyone. In parallel to this, a number of areas in London have been looking at minimising traffic in residential streets by limiting access to roads and blocking them off one side. So if you live there, you can get in, otherwise you can't just drive through. This is to make cycling and using scooters and walking much safer and healthier. Obviously, it creates more healthy environments, and it also encourages communities to use their streets better together. So again, one of the major co-benefits of this work is that it supports our objectives on improving mental health for Londoners too, and encourages more health and fitness, which is another area that we know we need to focus on. And finally, so we've also realized that we need to be much better at gathering data. So we need to really understand the impact of our risks, not just the plan for responding to the risks, but actually what happens when things have gone wrong and who is really effective. So the first step has been working with the London Resilience Partnership and all the partners to get them to share more data on pressures and problems with their systems. Inevitably, this is quite challenging and will always be quite challenging, but the coronavirus has shown that actually sharing information where we can and understanding where things go wrong will help organisations plan better, which means we have better outcomes for London. We also know that coming into this winter, we have lost some of our resilience. So, for example, workers, and especially healthcare workers, are tired from a long, very difficult sort of 18 months to 2 years now. We also know that supply chains are more fragile than before. And we can't solve these problems directly from where we are in London, but what we can do is we can understand them. And once we understand them, we can develop much better, more coordinated solutions across different agencies. And similarly, we know that Christmas this year, we're going to be facing a lot of challenges. For example, in local government finance, we know there are pressures on our health service with coronavirus and winter flu. We know that financial support for the most vulnerable is being withdrawn at the moment by central governments. All this is happening while things like housing costs, energy prices, and food prices are rising quite fast. So again, these are not problems we can solve as local government specifically, but what we can do is we can work together to counter this. So we're extending our working relationships with organisations across London, and especially the business community. And this will help us widen our shared understandings of how our risks, events and issues and things that could go wrong will really play out, and not just play out for us as responders, but play out for communities and play out for those in need of support, basically. And I guess this kind of adaptation to our adaptation to ways we respond will include far more measures on community communications, and developing ways to share information and impacts on risks we face and the pressures in the system. So all of this together, we think we have a way of moving beyond continuously being required to respond to events, but actually also then start looking at strategic recovery by looking at those longer term issues. I will pause there. Thank you, and I'll hand back to you, Lina.
Thank you, Alice. Very interesting. There are a lot of pieces that I think are worth further discussing. Also, how you position resilience, this heightened awareness, and how you take advantage of this to actually embed resilience into different kinds of agencies and policies and so on. This concept of, we didn't focus on impact of the crisis is actually, anyhow, it's very interesting, the whole approach, and this kind of self-reflection that you all have done also within the GLA, and so on. So I would like to move to Lenyo. So Lenyo Mirivilli is the Chief Resilience Officer of the City of Athens. She's also the acting Chief Heat Officer and the first Chief Heat Officer in Europe. She's also a Senior Fellow for the Resilience Center of the Atlantic Council. She's a resilient leader, both nationally and internationally. And she, until 2019, if I'm correct, she was also the Deputy Mayor for the City of Athens on climate change, greening, and resilience. Lenyo will share the experience of Athens, and I think we all have seen Athens in the news in terms of the fires, heat waves, floods recently. So Lenyo, the floor is yours.
Thank you, Lina. Thanks for the introduction. It's great to be here, virtually in Malmo. I guess I should start by saying that when we first released our resilience strategy, which was in 2017, which was kind of a systemic approach to the city, and kind of looking at this as Lina. I love that Lina has a shorthand of talking about resilience and resilient actions, which is that resilient policies and resilient actions are the ones that are multi-benefit, multi-hazard, and multi-stakeholder. So I really love this, Lina, and I use it very often. So I think it's a great little shorthand. So we created this policy that tried to be as multi-benefit, multi-hazard, and multi-stakeholder as possible. And then when we started going into the implementation in Athens of this strategy, we realized that, and also we created the Department of Resilience and Sustainability, as you said, Lina, to kind of start embedding the processes and the logic into the municipality, and also created these two teams that were cross-departmental in the municipality, that kind of were two ad hoc committees that met and brought together all of the different departments of the municipality, and that was the first time that something like that had happened interdepartmentally within the city. One department talking to the other department, trying to plan together and trying to work together on different, implementing different solutions. So even at that time, we realized that what was less addressed and what had less capacity within the municipality were issues that had to do with climate change. There was very little discourse about climate change. There were very little discussion or preparedness or any kind of understanding how our city worked as a unit impacted by the different climate, the challenges that are brought about by climate. So that's also why I asked and was given the position of as a deputy mayor for urban nature and climate adaptation. So started working on these issues. And then right about the time that this whole thing, my term was finished, COVID hit, like about a few months later, about a year later almost. And so the city started really focusing on, started building capacity around mostly digital services, as well as social and health services. So it started really building, because this was not something that was actually identified as one of the challenges that the city would be facing in the resilience strategy. We had discussed the pandemic as a pandemic as a challenge for the city. So the city started really kind of figuring out, together with central government, mostly responding with creating information systems, digital information systems, as well as social and health systems, and much more robust kind of social and health services than it had up to then. We already had created social services because that were helping the most vulnerable, the most socioeconomically vulnerable communities, because we had gone through an economic recession. And also we had kind of been focusing with vulnerable populations that were coming in as migrants to the city, which was like the period big challenges that we had faced. So this kind of created the possibility to quickly transition and add more specifically health services into the package of social services that we had created before in the municipality. What kind of became more clear through COVID, which is something that Alice also mentioned, is that the municipality started understanding that it needed to map vulnerability more clearly through this kind of pandemic crisis that we had. So suddenly the idea of vulnerability became much more concrete in the different departments of the municipality, and also the idea of going, as Ali said, to a super local level to deal with the issue. So what was actually the way, apart from kind of creating the digital services of communications and sharing kind of information, the other big kind of thing that we created that really became much more robust during this period was this thing called Help at Home Plus. And the Help at Home Plus, I think a lot of cities did this type of thing, which is actually to create services that go to the homes of the people that were not able to handle on different levels the challenges that COVID was creating, such as actually like older people that were living alone, that needed assistance for shopping or for cooking, or different kind of basic health services, etc. Were actually we created a network of several hundred people that were actually supported at home. And the reason I'm mentioning this is because this is an important kind of capacity that can quickly shift to problems that have to do with climate and heat, because this is the type of response that we also need in heat. So backing up a little bit, in general, if I can say that what came up, that what we learned from building resilience through the COVID period was one kind of understanding and mapping vulnerability. The second thing was creating much better channels of communication and capacity building through capacity building in communication, building our communication capacity in general. The third thing was that the municipality became much more clearly understood much better the idea of listening to science and to creating policies that are data-driven, which is something that we already had discussed and kind of tried to put, but COVID kind of brought this up to a different kind of understanding, a different kind of relief. It brought it to a great relief. And finally, the last thing that kind of became part of the discourse much more prominently as far as kind of building resilience is concerned was nature, bringing nature into the city within the context of COVID and within the context of how do we think of our public spaces in a different, from a different perspective. So this discourse again became more prominent. And then came the summer of 2021, and which started with a heat wave in June, and which was unexpected. Usually we don't have heat waves in June. It's usually July and August that our heat wave season is. So we had an early season heat wave. And then we decided that sometime in July, it was really a very hot summer. We just had a couple of weeks that were a little bit cooler, but it kind of continued. This was a really hot summer, and then I was appointed as the chief heat officer of Athens, which was kind of the launching of a collaboration between the Extreme Heat Resilience Alliance of the Atlantic Council and the Arst Rockefeller Resilience Center with the municipality of Athens and the mayor of Athens, decided that they should create this position, and actually this position could kind of create a movement towards more a better response and understanding better the issues of heat and how the issues of heat actually are very important for cities, and we haven't been talking and preparing enough for them. So let's put a focus on that, and through that focus kind of deal with resilience on different levels. Then came the incredible heat wave. So the actual chief heat officer was on the end of July, and then this incredible heat wave that started from Turkey and Greece and then moved all around the Mediterranean basin and gave record-breaking levels of heat that we had never seen before. Record-breaking for Europe levels of heat in the Mediterranean area. Really was a wake-up call for a lot of central government and local government politicians, which was very important because it really shook things up, and it created, for example, in Greece, a new Ministry of Climate Change was created, which we never had before. We had a shift in response and resilience building and response in relation to wildfires, because of course the heat wave, as you probably know from the media, the heat waves in all of these cases created wildfires around them because they were just, our trees and our forests were just ready to ignite after such a long period of very dry heat in the Mediterranean. We also kind of started talking about the Mediterranean being a very vulnerable part of the planet as far as rising heat. And we started to seriously discussing about issues that have to do with climate change, probably for the first time in our country, at least on that level, and I think with a different type of seriousness, because it was devastating, and because the images were devastating. So the communication of it all helped, because it really created it put the issues on relief, high relief. So as we were talking before we started this panel, and I will finish with that, we also had very recently an extraordinary, very intense rainfall, and which created great flooding, which also, because of the fires and because of the very, very long period of dryness, has created multiple risks and multiple vulnerabilities on different parts of our urban and peri-urban areas. So to wrap it up, as kind of focusing through the lens of heat, the idea is to kind of organize in three basic categories the responses that we are trying to do in building resilience. One is again on really building capacity and creating better communication channels between the communities and the governance structures, and that means also higher levels of transparency and have higher levels of participation and quote unquote democracy, which is a very big issue as we kind of start talking about climate change. For me, is like anyway. The second big kind of bucket is to create the capacity to heighten the capacity of protecting the most vulnerable populations during the different hazards and the different challenges that are being faced. So create better task force and response preparedness plans. And finally is to kind of figure out a more long-term plan of really transforming our urban fabric into something that is best prepared for heat and best prepared for climate challenges, as well as addressing different types of, again, multi-hazard, multi-benefit, and multi-stakeholder kind of actions and prepare and resilience in the urban setting. I said it. Thank you very much. This is where I close. Lina, the floor is yours.
Thank you, Lenyo. This is wonderful. Actually, you kind of described the journey that Athens has gone under, from the economic crisis to COVID to the big climate events that happened, and kind of the lessons that each kind of crisis brought, and it seems that the city actually is learning from this, and it's getting stronger after each kind of crisis, which is a basic principle and value of resilience, and it's not always given. So kudos to you and everyone in the municipality for the work that you're doing. So I want to go to Tel Aviv-Yafo and to my colleague and friend Anat Ezik-Kaspi. Anat is the head of city partnerships and deputy chief resilience officer of Resilience and Social Equity Authority of Tel Aviv-Yafo. Anat leads strategic collaborations with governments, with NGOs, with civil society at the local, national, and global level. Anat, I mean, I think everyone was looking into Tel Aviv and to Israel in general, in how, both in terms of the response and also the recovery process. For us, it is also very interesting because the resilience agenda is part of this new authority on social equity. So we would like to hear exactly how, the social component was part of your response and recovery, and how it connects with what Alice and Lenyo have shared so far.
Gladly. So thank you, Lina, and hello to Malmo and all my resilient community friends around who are with us, and big kudos to the organizers. And thank you, Lina, not only for the panel, but for your leadership in the EMA CROs Forum, which is a great place for us. So, Tel Aviv is a city of innovation and entrepreneurship, and really, as all of us, we had to face the changing circumstances. And the first thing we were guided to do by the mayor was to write and actually keep all the being doings, all the downs written, so we can be looking in the future and see what the municipality has been doing. So I wish just to let you know all that the full response of Tel Aviv to COVID is online on Tel Aviv municipality site, and is very, very detailed, and I find it interesting. So I will look specifically to our resilient work relating gender equality, because the unit of resilience and social equality was established a few months before the corona broke to our lives. A few backgrounds the sentence. So Tel Aviv-Yafo is a generator of change for the entire country. It means we kind of make the path and policy on a national level. And also we are home to diverse populations of women from different cultural, ethnic, social, and economic perspective. So, and we see that the justice for society is for all. I mean, gender equality means justice for the whole society, men and women alike. And the city actually chose to be a beacon of equality and trailblazer in many areas.